In eras of flu seasons and pandemics, the use of masks has become the question of the day. With yeses and nos and maybes and ands and buts as answers, it's become confusing for everyone. The aim of this video is to help you learn about how to properly use a mask, as well as some do's and don'ts to remember. When it comes to masks, any material is better than no material to reduce exposure to germs. Obviously, some materials are far superior than others. For example, surgical masks used by healthcare workers are better than 2 layers of tea towels, which is again better than wearing a scarf. But irrespective of the type of material you use as a mask, there are some key considerations to help reduce contamination risks to you and your family. First, germs can escape especially with the pressures of coughs or with bad fitting masks, where the germs are allowed to bypass the filter seal. Second, germs can spread to and from hands and masks and more. Researchers show that many people remove their masks to cough, sneeze, and wipe their nose. Third, germs transfer across a mask when it gets wet. The moisture increases the transmission of viruses and bacteria across masks. And fourth, it's important to remember that in all cases, your eyes are not protected and germs can be transferred by contact with the eyes. So it's important to remember how quickly a mask can become a biohazard as you handle your mask. So in light of the dangerous aspects of masks, how do we go about wearing masks properly? Here are some do's and don'ts. Do wear a mask if you're taking care of a person with suspected infection, or if you yourself are coughing or sneezing. Do wash your hands before, during, and after everything. After handling your mask, before handling your mask, after interacting with other people, after going out to do groceries. Do practice social distancing, 2-meter distance, and limiting outings. Do wash homemade masks regularly with regular detergent in a regular cycle. In addition to the do's, there are some don'ts or cautionary notes. Don't wear your mask when it becomes wet. Replace the mask when wet. Don't stop. Do not touch your mask at any time except to put it on and take it off. And remember that masks can quickly become a biohazard. Here are some takeaway messages for you. First, any mask is as good as its fabric filtering efficiency and the seal between the mask and the face. Second, it is actually the use of the masks or misuse of masks that limits their effectiveness and can actually increase exposure to germs for yourself and others. Flu rates have been found to be lower when masks are paired with proper hand hygiene and other preventative measures. Very important to remember that a mask is only one of a set of preventative measures. Other measures include regular hand washing, isolation of likely and infected people, good respiratory, coughing, nose etiquette, and when available, vaccination, immunization. So the final takeaway is combine masks with other preventative measures. Thank you and stay safe.